Well, my friends, this is an established case of rheumatoid arthritis. An established case of rheumatoid arthritis. Patient is this man, age about 50 years. Pain and stiffness of the different joints. But the left wrist joint is totally immobile. It is totally immobile, fixed. You know, there are the two bones. The medial side, the body side is known as medial side. The bone is ulna, and the lateral side, the bone is radius. And this radius and ulna joins with the smaller 8 bones. The 8 bones fuses one after another. These are known as carpal bones. These are known as? What is the name of the carpal bones? Scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. There are 8 bones. And these joints are fixed. Radiocarpal joint, ulnocarpal joint, and the intercarpal joints. There are intercarpal, scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. And there are, this is called the intercarpal joints. This is called the radiocarpal joints. This is called the ulnocarpal joints and intercarpal joints. And the carpal joints mixed with the long bones. These are known as metacarpal. So metacarpo-carpal joints. Metacarpo-carpal joints. And when the carpal bone joins with the phalanges, known as metacarpo-phalangeal joints. Now these radioulnar, radiocarpal, ulnocarpal, and intercarpal joints are fixed. There is no movement. In this hand, there is a little bit of movement, but this is totally flexed. The patient cannot flexed, cannot flexed. So this is a case of rheumatoid arthritis. Other joints are movable, still movable. This is the neck joint, movable in the left side and right side. Shoulder joint is movable. The elbow joint is movable. In both sides. Hip joints are movable, but these joints is totally fused. So this is the typical and advanced case of a rheumatoid arthritis. You know, the rheumatoid arthritis is nothing but a immune deficiency disease. There is no germ, no bacteria, no virus, no protozoa, no helminth, but a connective tissue disorder disease, immune deficiency disease. And that's why allopathic physicians or modern physicians cannot do permanent cure, cannot cure permanently, because there is no causative agents, there is no causative factors behind of this disease. So they only treat by painkillers. And the painkillers ultimately complicates the kidney, and the patient becomes a victim of chronic kidney disease. So in homeopathy, we treat the patient as a whole, and this is the scope of homeopathic treatment, as this is an immune deficiency disorder, immune disturbance disorder. So we have enough scope. But the treatment procedure of homeopaths are same, only one, the eternal truth, treat the patient, not the disease. This patient having burning palm and soles, the disease itself is psychotic. In the family, there is number of persons are suffering from arthritis, and the disease itself of the patient, and including the family history of the patient, all in together go in favor of psychosis. So psychosis is predominance, and it is in the background of the patient as well as background in the family. And other symptoms are desire for sweets, burning palm and soles, pain relief by cold applications, though our favorable medicine is Medrolum. So Medrolum is the choice of medicines. So we do like to prescribe Medrolum 1 2 doses, followed by PTRS 10,000. Let's see the result. I shall share you, my friends. Many homeopaths forget about the auxiliary measures and about the exercise, food, diet, nutrition, etc. So you should give the advice properly to the patient. This patient requires the movement of the joints and physiotherapy, etc. Auxiliary measures also helps to cure a patient permanently. Only medicine cannot cure a patient. To cure a patient, the auxiliary measures, the supporting features, along with the assurance by the physician's tact and talent is also very, very necessary and essential or indispensable, my friends.